If anyone's not familiar, because of the fact that our federal government is refusing to grant the people universal health care, refusing to enact any sort of a single payer Medicare for all program, the likes of which have been proposed by Bernie Sanders in the Senate and Premier Jayapal in the House. Pretty standard policy, which most of the rest of the developed world grants their citizens. Anyway, since we aren't having, those granted to us, those rights, state by state, activists have taken it upon themselves to try to enact a ballot measure or a policy that could get through the state legislature to enable at least a statewide universal healthcare system. And that's pretty much what whole Washington is about, trying to fight for universal healthcare, at least within the borders of the state of Washington. So obviously, since the presidential campaign is over, Bernie Sanders, the champion of Medicare for All, did not win. The movement, continues on. The fight carries on. Just because Joe Biden does not support Medicare for All does not mean that people aren't, still dying because of their lack of health insurance. And the most people can do, probably at least, is try to at least ensure that their community around them, the people in their immediate area, their district, their state, have the access to the care they need. And that's what you guys are working on. So I just wanted to say that we think this is a great mission. We think it's a really good way to keep the ball rolling on Medicare for all, even though we have an absence of a leader like Bernie Sanders right now, who's kind of fighting for it on a national stage. Personally, I think this is the right approach. Does anyone want to speak to that?
Well, I'm happy to. So I think the first thing is just how much people tend to focus on a single strategy. And I think that one of the really important things that I want to bring to this conversation is just how the fight for healthcare in this country is not over until literally everybody is covered. And that is really a fight on all fronts. I don't think that there's any way to argue that state-based efforts somehow weaken or are contradictory to a national strategy. And so, when I worked on Bernie's campaign in 2016, and, unfortunately that came to an end, I really wanted to find, so what can I do, right? And it was just really amazing to find such a well-developed healthcare campaign happening like right there in my home state. And I think if there was a robust campaign like that in all 50 states, we would be both closer to getting it in the first state and we would be closer to getting it nationally.
Yeah, I think that's a really great point, Andre. And one of the things, while we're on the topic of Washington, that's the whole theme of this episode. One of the strategies that was actually used to legalize, marijuana in states at a statewide level, obviously Washington being one of the first states to do so, along with Colorado. And now we see Chuck Schumer and Cory Booker are, not progressive guys in the Senate, right? But they're pushing legislation to federally legalize cannabis, right? It's been talked about that even somebody as, neoliberal and, the author of the crime bill himself, Joe Biden, would be even willing to sign something like that. And that's only because you've been able to, from a local grassroots level, get enough ballot support pass these initiatives and slowly change the conversation around the country. I think that this makes the case even stronger for what you guys are trying to do with essentially building a single payer system just for the state of Washington. And if it was able to be successful here, I think you would naturally see more progressive states follow and take another shot at it. I think people, just because Bernie Sanders wasn't able to get single payer in Vermont, people seem to talk about it as if it's impossible.
No, I totally agree. I mean, it's important to be pushing the envelope at every opportunity and on every front. What we are finding here in state. And, oh, by the way, with I-502 back in 2012, that was the legalization of marijuana bill. I was a top signature gatherer in the state for that thing as well. And I also want to shout out, before we continue with whole Washington, that we have a ranked choice voting bill that very well may make it through our legislature this year. And so Washington will join, I think, just a couple of other states.
Maine has ranked choice voting. Maine, I believe it just It didn't get voted in Massachusetts, unfortunately, this last time around.
Right. And I don't think it didn't get voted in Alaska, but I know it was on the table in Alaska. Did it get in Alaska?
I do believe it did. Yes.
Yeah, but to your point, it is so important to just take these issues that are going to be very beneficial. Another one here in Washington that we've got on the table, same guy who sponsored Hold Washington, is a state bank, that we would have a state bank where we wouldn't have to go to private banking systems to get funding at interest that goes to them for our capital projects, for our government projects here in state, and that any interest that was charged on those projects would go directly into the coffers of the state, rather than to a CEO salary. So again, so important to take every issue and see what you can do to get it done on all levels. And so that's absolutely what Whole Washington is doing.
And Laura, like I said, we talked to you a little bit ago about Medicare for All and generally being an activist. I'm wondering how you got involved in this movement, and what in specific you're doing to help move this ball along.
Well, I was just on, I've told the story quite a few times of being, but maybe not for this particular thing, but I started tweeting about or posting on Facebook about Red Berets. So that's basically a nurse core member of Whole Washington saw those and said, "Are you familiar with Whole Washington?" Nope, not at all. I don't know anybody. And so it was actually my first Whole Washington meeting that I went down to Olympia to a house party. And that's where I met another nurse, Mariana Everson, who's absolutely amazing. And she is also on the board of Whole Washington. So that's kind of the story of how I got connected up to Whole Washington and Washington Bernie-Crats Coalition. And currently I'm just really, really excited because I just, this is my second podcast of the night. So, so I was on with Ryan Knight, and I feel like that went well. I'm sure it went great. Yeah. So, mostly, I don't know if I want to give her a heads up. Yeah, I pretty much just asked for Representative Premier Jayapal's endorsement, or, the question was kind of like, do you think that progressive leaders are doing enough right now to challenge the Democratic Party? So, well, you'll see the whole thing when it comes out, and that's coming on Monday. But I just think what's kind of inspired me, because I kind of walked a careful line with that stuff for a while. Number one, it's nice to be loved. So people love the Red Berets, because as the part that's been like, for Bernie and for the national movement. And I mean, we're doing it all synergistically. But I think when it comes to like actually asking, for something, for endorsements like Jason Call for Congress and for Whole Washington, and for people that are actually really in this fight, people who have written the most progressive Democratic Party platform. It's universal healthcare is on the Washington State Democratic Party platform, and that's because Jason and a couple other people put it there. So I would like to see more endorsements. So I put that call out. I'm just going to finish by saying what kind of inspired me to put that out there, and I'm going to begin asking more, is because I didn't even really think that I could reach out. There's a part of me that doesn't feel like I'm good enough to ask for stuff, even though Justin Jackson has been following me for quite some time. I was like, when he first followed me, I was like, why is this football player following me? And then I find out, he's really progressive and for Medicare for All. And then he was prominent in Force the Vote. And then it just occurred to me a couple of weeks back, why don't I just DM him and ask, like, what is he going to do? Say, oh, you're awful for advocating for Medicare for All. Why are you asking me to do your event? So, I mean, it's coming down to just the point where I'm going to start being bold and actually asking our progressives for things. The least
It's crazy you have to ask Justin Jackson instead of Premier Jayapal, who, of course, introduced the bill in the House. And I'm just wondering if you have any perspective on why someone who would fight for Medicare for All on a nationwide level would then proceed to not endorse or show interest in a movement for Medicare for All on a statewide level, which, like Zach said, similarly to cannabis, would certainly raise awareness of or get the ball rolling on this nationwide movement. If I was a cannabis advocate or activist that was fighting for the federal legalization of cannabis, and then a state wanted to do it, I think I would certainly see the value in that project. So I don't understand why it wouldn't apply to someone like Premier Jayapal, who clearly understands the value and necessity of Medicare for all as a concept.
Yeah. Can I say a little bit about that?
Yeah. Please.
Yeah, so I'm not gonna explicitly say why, because I don't know, but like I want to also really emphasize how much alleged support there is for this in Washington. I mean, Washington is like a famously progressive state, but like as has been mentioned, like I was a state delegate for Bernie in 2020, worked on the state platform, and like I was ready to like raise some hell and be like, oh, you got to get Medicare for all in here, and it was already there. Like not even like weasel words like universal or anything like that. It was like full on like the government is gonna insure everybody, and that's in the state platform. And we gave the Democratic Party a trifecta in 2018 and have held it for them, right? So they have complete control of the government. And when we were working on the legislative strategy, they had commissioned a study in 2017 that found that single payer was the most efficient, cost-effective healthcare system. We had introduced a second bill that made it considerably more robust. We had added a financing plan, a transition plan, and basically we're told that it had no chance of passing. It doesn't have the support it needs. It's not ready. It's not good enough legislation. And yet they gave a hearing to another bill that is allegedly a universal healthcare bill that has more co-sponsors. The legislature is like, well, this is the real serious bill. It's literally 4 pages long. And the first 6 years, right? One of the only things it says is that for like the first 6 years, they basically can just investigate options, which has already been done.
It's because it's not a healthcare bill. I mean, that's what they are looking at right now is not an actual healthcare bill. It is not the actual legislation of how single payer healthcare would work in the state. I mean, it's called a commission. They want to bring people together so that 3 years down the road, they can come up with a bill that is not going to be any better than what's on the table with whole Washington's bill right now.
So they're just kicking the can, basically.
Guaranteed. They are kicking the can down the road. It's a minimum of a 3-year delay on getting single payer in state. There's absolutely no reason for it. And one of the couple of things that are really telling is that nobody has an actual criticism of the bill. If we say to people, what is wrong with the bill? Okay, the biggest thing is most of them haven't read it. I mean, they're just doing this kind of thing, and they're simply not reading it. So we want to make sure that they read the bill. That's why we've got this nice handy fact sheet that, like, if you wanted a summary of what this bill accomplishes, there it is. You've got these health committees in both the House and the Senate who are deeply, deeply in the pockets of the for-profit medical industry. In fact, the chairs of the House and Senate Health Committee, between the two of them, have taken $500,000 from really corporate interests in terms of their reelection campaigns. And so they're not even, and they have sole control over whether that bill gets a hearing as chair of that committee, and they are pushing it aside for a delay bill. It's really gross.
Yeah, I can't fathom. I mean, unless it's just political calculation, which it probably is, and yeah, I don't know. I don't spend a lot of time thinking. I don't know. It just baffles me that this isn't the kind of thing that Premier Jayapal would just take and be like, "See, this is exactly what we need to do. We can do it in Washington, and you can do it nationally." Like, of course, like it's just a no-brainer to me. Like, I don't understand that. And maybe that's just I don't know, because as somebody who, I mean, I believe Premier Jayapal genuinely wants to pass a single payer Medicare for all system in this country, but yeah, I just can't. I don't know. I'm struggling to understand the rationale for why she wouldn't get behind that.
And one thing is often that I think we're seeing some element of control. Like I think that the legislature wants to say, we get to make the call on this, right? It's our place to pass whatever healthcare legislation is going to pass. So they don't like the initiative. And then the people who are in the federal level are like, well, I'm a federal legislator and I think in federal terms, and therefore I maybe see statewide initiatives as somehow kind of stepping on our toes. I mean, I don't necessarily know, but a lot of this stuff, I mean, I don't want to like undercut, the influence of like, campaign donations and that kind of thing. But like, I also think that people get very invested in their own strategies and the things that they have direct control over. They would rather say, I'll do it than like, build a coalition with somebody else. Like, there's like vanity and stuff that comes into it. So I don't know. It's shocking to me. And one of the things
right now kind of reminds me of the whole force the vote debacle, which obviously we could, argue about the different merits of it. But it seemed like what you're describing came into play, which was what was, in my opinion, and a lot of other people's opinion, a very sound and good strategy, was kind of kicked aside by a lot of people who decided that like, well, this is associated with other people and it's not my thing and it's not what I've been pushing forward and wasn't my idea. So therefore I'm not going to get behind it or support it or even acknowledge the merits of it in the first place. Is that kind of like what we're looking at?
Well, I'll hop in right there and say, I'm going to start framing this as what I feel that it is. It's a top-down strategy versus a bottom-up strategy. And there was a time where I was patient for, playing the game and sort of asking nicely and meekly. And of course, I think it's better to ask nicely, but it's also at the point where it's getting, it's getting uncomfortable because there's I don't know, if you can't get a bunch of people together in red berets, the Seattle Peace Choir, putting on all these different red berets. There was literally a musical score written by Doug Balcom, and we're just posting and tweeting that all over. I put it on Dr. Jane Sanders' Twitter feed, and there was like a whole, come on, she saw it. We just need it needs like if the movement is going to continue in any way, irregardless of the strategy of whether reforms are continuing to be pushed within the Democratic Party or the section of the movement that believes we need to do all the pressure from outside. Regardless, we need to start seeing a whole lot more solidarity for the people who are doing the actual work. Like, we can't have a revolution if we can't get an endorsement for a candidate who's literally like fighting for Medicare for all as a board member of whole. We just need to see the solidarity. They have to let go of that control, because what happens is it's just, we're the people that are doing the most actions for the federal bills. And so if we don't start to get, this is amazing work. Obviously, I'm a federal legislator. I'm going to be very, very focused on on my bill, but darn it, I'm a Washington, I represent Washington. You can have my signature, like, for example, when and if we're going to be doing another ballot initiative, there should be some kind of a statement of support. Thank you for all of your hard work, whole Washington. I know that you organized all these barnstorms, and there needs to be more support and more solidarity. And I look forward to continuing to ask for that, and asking others to join me in asking for that, not only from Representative Jayapal, but just from our progressive leaders in Congress, because we don't just need elected progressives, we need movement leaders. It's no longer good enough to just have an elected progressive Democrat. I will continue to donate and support Jason Call because he's walking the walk. It's no longer good enough to just see a tweet that's like, and now we can't even see a tweet that's for Medicare for all, right? I saw one earlier, but I won't call out what it was, but it was an organization that literally just tweeted out an event that said affordable health care. And it's, come on, I'm not even going to go there. But we need movement leaders. We need people like Jason Call running, who are like, I've gathered thousands of signatures. I've sat on the board. I've researched and revealed that the healthcare committee has taken over $1 million in Washington state. And guess what? When I'm elected to Congress, I'm going to do that at the federal level. And you can count on me when I'm elected to go full bore at people in both parties to say, this is no longer okay. We can't get this legislation passed because you have accepted X amount of money from private insurance. Like, we need that kind of boldness. And as long as I see it in Democrats, I'm going to support them. I'm going to support those people wherever I see them. But we need a hell of a lot more solidarity, because we can have tireless energy for these causes. I will continue knitting these red berets. I'll continue making the calls and everything, but there's no fuel for the movement because we aren't getting those like pats, thank you for your hard work. Keep at it because we can do this. Like, they can't expect us.
Well, just to interrupt you for one moment, Laura, from the Vanguard, we really do sincerely appreciate the hard work that you guys are doing. And from, obviously, the national elected officials that aren't recognizing it. But one of the things I do think is that, people who are listening to our show and people who have shows like us, or much bigger shows like Ryan Knight, they see the work that you're doing, and it's tremendously valuable. And just to circle back around to a point that you were making earlier about the kind of nerves that you would feel reaching out to, somebody of like an amount of stature, like Justin Jackson's a cool guy, but like, I'm sure he wants healthcare badly. I'm sure he's happy to do whatever he can to, lend credence because he's really good at football, and now he has a platform, right? But obviously, it should be coming from the people. Like our elected officials, but since it's not, I think it's the role of regular working people to just continue to support each other. And so, I think the work that you guys are doing is just incredibly valuable. So I just wanted to pause and take a moment to as best we can, throw some love your way, because Gavin and I are constantly inspired by the work that all the activists that we talk to are doing, the groundwork. It's so hard and it's so easy to feel like, none of it matters and that we're working in a vacuum and it's a Sisyphusian task, right? A fool's errand to try and do these things, but it's not, right? We're doing this all out of empathy and all out of solidarity and humanity. And that's what the world needs more of. So, hokey shit aside, you're doing good work, and I think everybody that's listening would echo that sentiment.
And to take things back to the cannabis conversation, which I think is an obvious comparison because of the Washington state commonality. I mean, look at where we are right now in this country. It's obviously inevitable that federal legalization is coming. We have the entire, economy centered around cannabis now, or not the entire economy, but there is an entire economy centered around cannabis. It's clearly something that can't be stopped. And if you had gone back in time 10 or 20 years and told someone that would be the case, they really wouldn't believe you. It was still a taboo. It was still considered something that, criminals in the back alley were doing. It was not normalized in the way it is now. And there's no reason that same principle can't be applied to other policies like Medicare for all. And similarly to cannabis, there are tireless, thousands and thousands of activists that, their names are known. They're not commonplace, heroes as far as American politics goes, but they're the ones that were responsible. They got the ball rolling, and that's you guys. That's the three of you that are on this call. You may not be household names even within the activist community, but the fact that you're getting this ball rolling and refusing to step down from this fight just because, again, we have Joe Biden who's going down this neoliberal path like we all knew he would. You're keeping this fire lit. You're keeping this fight going, and I think that the state-by-state model is honestly a perfect model for this situation, because if Washington passes this, it's going to be a huge story. I mean, I would move to Washington. Just who wouldn't? Like, it would be a great thing. It would be the everyone would want to be there.
Yeah, and just to follow up on that, I think it also brings home a point that it would just underscore the how broken our system of governance is, right? If the only way that you can get legislation passed is through ballot initiatives, then we do not have a representative government any longer, right? And I think that's just this is just another example of that. We need to have a direct ballot initiative because our government has failed us so badly. We can no longer trust them to implement the policies that we have entrusted them to do on our behalf, which is the entire justification that we have for this flimsy electoral democracy.